not having it done
How
sooner.
long was it between lidocaine and doing the actual MVD?
That was in May, and my surgery was the very end of July. But my initial TN diagnosis was about 22 months from diagnosis to surgery.
My wife seen Casey for the first time Monday.
And I know a lot of people have said they go to see Dr. Malik.
Yeah,
He
she's
was-
seen Malik about 2 years ago. And about the only thing he did was, he did some kind of injection, I don't know, it killed a nerve or whatever. It didn't do anything, and it was like,
Yeah, that's who
she just stopped going to him.
Well, a
My
lot of times they do
neurologist-
that. Dr. Tu that she used to work with when I went there about 18 years ago, he did like a nerve block, which
Yeah.
tells him whether we should go ahead with procedures or not.
Well,
And my response was a negative, and so
I'll
stay
tell you
away
what
from
what
procedures.
impressed me about Casey, they moved her up. I dropped your name and Lynn's name a few times, and we were able to get an earlier appointment. But what impressed me about him was he actually did some tests on her. He actually took an ice cube and went around and was asking her all kind of questions. He looked inside her mouth, which I can't remember a neurosurgeon ever doing that other than saying a letter. He said, I'm gonna send it to him, tell him here's what I think, here's who I want you to go see, and I want him to concur. And that just about floored me. Okay, you're not gonna pick up the phone and talk to him, but you're actually gonna send him something?
After every appointment that I had with him, he would always ask me, verify your primary care, verify your neurologist, because they're getting a copy of what we've discussed.
And he didn't rush us. He actually took us during lunchtime, I think. Because, and
Well, you guys had such a terrible accident. You had to
well,
be
the first
so-
time when we went,
Oh,
that's when there
sad.
was an accident on the Rouge Bridge where the car hit a work crew and the fire, so we
Yeah.
missed that one. But they squeezed us in the following week. But one of the things that kind of impressed me about him is, him and my wife were chatting, and my wife just looked at him and says, are you gonna be able to help me? Or are you just gonna screw me around like all the other ones do? Take this, take that, take this, and sorry, I can't help you, because she's to the point.
Yeah,
Yeah.
you
See
get
Malik?
that, you get that way.
That's what you
This
gotta
other
do.
name, Frank Jung,
Yeah,
I-
yeah. Did you see him?
she's seen him.
What do you think?
He just pretty much blew her off and said,
Really?
Who is that?
go see an oral surgeon.
Frederick
Actually, her
Young.
first
Yeah.
gamma knife, she was supposed to have gamma knife surgery.
Yeah.
He canceled it because he was gonna be, the neurosurgeon that was gonna be there while they were doing it. And 2 days before the surgery, we got a call. And the nurse said, the neurosurgeon just canceled it. Who? Frank Jones. Why?
Why?
I don't know, you don't have to call me, just canceled it. I said, well, what do I do now?
Oh, my
So I can give you the name of another neurosurgeon. Look, here we go again. Oral surgeon, neurologist. Send you to a neurosurgeon back to the office. She has seen so many.
It's like a
that-
full-time job.
That's more frustrating than anything else. And what's funny is you can't get two of them to say the same thing. One will tell you to go have gamma knife surgery, right? The other one will say, no, you don't want that done. It's like, well, can't you guys all get on the same page?
That's
I
why
mean,
you're at a support group meeting.
Did your wife have the gamma ray
Nope,
after?
twice. She was scheduled twice, and both times it was canceled.
They canceled? She did not cancel?
She didn't cancel, they
So,
canceled. So the
she
first
might-
time was because Jung, for whatever reason, he canceled it. He told them, don't do it, because he was the head or whatever. The second time, when she went for her preliminary meeting,
Right.
one of the doctors that was in there, he was looking at her, and he said, you know, you're really swollen. She said, yeah, it's really becoming a problem, all that swelling and that. He said, well, gamma ray isn't gonna do anything for swelling. He says, you may wanna go see
Now, you're Myra, right?
Myra.
Myra.
No.
Really, it comes down to the patient looking at the 5 procedures and seeing if they want any of them, or whether, you know, most of them
But
say
it shouldn't
continue
be up
with
to the
that.
patient, right? I mean,
Well,
the
it has
doctor
to.
should, you know, it's like me going in with my car and saying, my tire's flat. Well, I can sell
Yeah,
you a
but
new
see,
tire,
Fred-
I can put more air in, I
Okay.
can, well, you tell me, you're the mechanic.
You
You're
haven't
gonna leave it
come,
up to me?
you haven't come to enough meetings, it's not that easy.
Now,
See,
what-
that's why I
Not that
disagree
easy.
with
No,
these
it's
guys.
not.
I mean,
So what
it's
was,
frustrating.
I know it
Yeah.
is, that's
But
why you're
anyway,
the
so
support.
she
other
asked
than-
Malik,
so other
and
than-
not Malik, but she asked
so other than
Casey.
the referrals to a couple specialists and the letter back to her primary care, is he able to move forward in her treatment?
What she asked him is, are you gonna help me? Can you do anything? He looked at her, first one, he looked at her and he thought for a minute and he told her, he says, if I didn't think I could help you, he says, I would tell you.
Who is this, Casey?
And he said,
Casey?
Casey,
Yeah.
and he said, did you see the patients that left him? He said, I just told them something they didn't wanna hear. He said, I'm not gonna pull any punches with you.
Right.
So he said, when I get the reports from the oral surgeons, when I send this letter, he says, then we're gonna go from there.
Okay.
He said, there's a lot of different things, he said, but I wanna see, and the other thing is he looked at her latest MRI, and the radiologist, whatever he wrote on there, he said, that's not right. He said, that's not right. He said, I'm gonna request that your doctor have a neuroradiologist read it.
That's
He said,
smart.
because what he wrote on here, he said, it's impossible, something about the audio nerve or the audio canal, and I didn't understand what he was
Yeah,
saying, but
yeah.
he said, so once I get the reports, see what your doctor has to say. So I want you to see an ENT guy. He says, then, he says, we'll go from there.
Now, does she have, because I don't know much about your wife's case, does she have a lot of flares or spikes in
Constant.
pain?
She's been diagnosed with atypical neuralgia. It's a constant.
She
I was
doesn't
thinking-
get the shocks. She doesn't get the shocks.
Like
Or did it start out at
the
shocks?
burning,
I
the
think she
numbing, the
gets them
pressure?
both.
Yeah.
I really do.
So that's
did
what
it-
she's working with now.
Way before she was on any medication, was it shocks only? And then it moved, like we discussed with Dr. Air a lot of times, it moves. so you
It's
have
so
to-
hard to really describe shock and electrical and pain.
But forget
because-
that, the issue is intermittent or constant.
No,
Make it that
hers
simple.
is constant.
But it is now. But like she said, if it started out intermittent, some of the procedures
Oh,
may help.
got it.
May help. Usually they'll say it won't help with the constant pain, but it'll help with the
Oh,
shocks.
right, the intermittent, yes.
It's either
When you don't know
intermittent
when
or
it's coming
constant.
on.
And it should talk about what it was like before you were on any if you can remember. That's the tough part.
But Dr.
Yeah.
Casey disagrees with what she said, because he still does it on TN2, does an MVD.
Yeah,
Oh,
and the
and
other,
Dr.
the other
He
thing,
just says it won't last as
Yeah.
long, the effect, the
So
benefit.
doesn't he
I
say,
should
like
call it.
Piper said, that it would only help the shocks and not the constant pain?
No,
No.
he
Well.
says, no, in fact, I watched a webinar on
Yeah.
him saying
Yeah.
that he thinks that it will still
See-
benefit you, he just doesn't think the benefits will last as long.
see, this is where it gets
Well, they got their own
confusing.
opinions.
Right.
Well, he's done more MVDs than
Right.
anybody in the world, so.
Right.
And
We're
this
gonna argue
this
with
is
him.
where it gets
Right.
confusing, because she said a few times about cutting the nerve.
No, that was at, somebody else did it. She did, I don't think she did it.
Casey, so what the hell they do that for? That
Right.
doesn't do anything.
Right.
So we've learned not to do that,
Right.
because you could get
No, I'm
neuropathy
just
or
gonna
something
drop
in the
it.
end of the
Get
nerve, and it's
Yeah.
like,
I like what he
Well,
said.
girls will know.
Well, he was
Yeah, but he's
Yeah, but he's gonna, they're gonna mail it to him.
He keeps you
Dr.
awake so he
Piper
can see
said that
everything's working.
if
Four of
one
them?
was outlawed,
That's
yeah,
what we do it for
Yeah.
still something got outlawed. So it's like, there is, you know,
He'll,
You
he's
know,
got his
it-
monitoring.
Yeah, I do too,
it's
but
like
checks to
one
make
almost
sure that all of your
contradicts
vitals
another.
well, I think that just goes to show you that
And
they
if something
don't
They don't know.
know for
They don't know.
sure.
It's how difficult this
Right.
condition is.
Right,
Yeah.
exactly.
Because the.
Now, most of them will say the gold standard is the
I'm snapping my
microvascular,
finger,
if you have the
hear that,
intermittent pain.
hear me
But if you
talking,
have more of the constant pain,
he
the
does
neurosurgeon
that
told me
once
18
in
years ago,
a
stay away from any procedure.
I thought
If the
you
opiates
had
are working for you,
surgery.
don't let them touch you with a
Yeah,
knife.
out,
And that's
no.
why I stay
Yeah,
away from
you're completely out.
Because I had shocks and I knew what mine was. Mine was infection that damaged the infraorbital branch off the V2, so I knew what it was.
He did that.
Almost for sure. Only God knows really. But we were pretty sure what it was, so the opiates were, I got a trigger point right there, right above that tooth. You do
But
too.
they also told us for so long as medications were
Yes.
working,
Right.
stay on meds. Well, now they say you're probably like this due
Do
to
it.
waiting so long.
Right, right.
So it's like,
Now
Yeah,
there's,
but then,
Thank you,
but
you
then
know?
this doesn't, the surgery doesn't last long either.
there you go.
And the motor cortex doesn't either,
well,
so.
wait, no, you got, well, it's rare. You had Claire and
Yeah.
Pasternak, their
Yeah.
MVDs are
Sorry,
still
that-
working.
So two
Motor.
people I know in the whole world, it lasted forever. Yay.
Well, there's other
Well,
ones.
and that
There's
motor
You gotta start somewhere. You gotta start somewhere.
Yeah, but they
motor
had-
cortex
Sorry,
doesn't look like.
Yeah.
20 years
classic.
later,
I'm
I'm just not
sorry.
jumping for joy.
Yeah.
What?
Okay, well,
You
you
said
know, I
8 or
had
9
mine
years.
in
She said 8 or 9 months.
2006.
Mhm.
Okay, and Dr. Casey did mine, and I love Dr. Casey.
Right.
It's like, and then when I went back, not last November, but the November before that, it's like now my TMJ is totally gone due to that creep. It is totally gone. Yes.
But did the MVD help?
No,
Yeah,
it did,
that's
it made it worse, and
right.
what he told me
Yeah.
is, and I seen, because what has happened
Hmm.
is my, TN has gotten worse. I now have it down the back of my throat, but the cream is helping
I gotta
that.
put-
get that
you
cream
put-
back out
Are
again.
you swallowing it?
I am.
Swallowing it?
What's that?
Two big jars of it.
Oh, you tried it already, Mary?
Yeah,
seen
oh,
it.
I told you guys about it.
Oh,
Yes.
before? Oh.
I
Yes.
did about a year
And
ago.
it's in both
Yeah.
Did it
ears,
ever help?
yes.
It did help,
my
but I said I
mouth.
started
It's
breaking
the
out
whole
from
you
it,
said
so
that,
I
yeah.
stopped using
My
But
it.
you got a
whole
rash?
tongue,
Did.
Like when I
You
would
were
swallow,
allergic.
but
Me,
right
I
now,
get-
no, I
yeah.
got
You're
one
sensitive.
spot that burns. But the cream,
Drugs
put the
and,
cream
Sit
on.
in your
yeah,
mouth.
that was
No,
the
you
first
can't.
topical
You
I
put
ever
it
broke
up your
out from
nose,
though.
in your ears, but you can't put
But
it in your mouth.
it took some of the neuropathy away.
Yeah,
When
Yeah.
that's good to hear.
When did you
I
start getting
started
it in your
order.
mouth?
Oh my goodness. It's been I don't know, it's been quite a while. It's been a couple years now. See what happened, Lynn, when I come off the pain pills in 2013, I didn't realize what the pain pills were masking, what they were
Right,
covering up. They were,
right.
you know what I mean?
Right.
And I didn't realize how much burning,
Yeah.
boring, aching, throbbing I had.
Yeah,
Then-
you got old in the meantime.
Yeah.
Right?
Yeah, I did, exactly.
I know.
Yeah, exactly, I was freaking.
Yeah.
It's like,
Well,
that
it's
is-
just the truth.
it is. And it was awful, and then I got on Suboxone. Okay, that just messed me up. I cannot get pain pills ever again. There's no doctor. Suboxone, and that's what they use to take you off the pain pills. Cause I was on them 13 years, and Tim knows,
Come
I was
off,
on
yeah.
quite high doses, yeah.
Yeah.
And it's like, but now, with the cream, alls I can do, that's what I was gonna say, what's my next option? I don't have one.
Yeah.
Because I've had three
Yeah, you had one, you
surgeons.
talked about it, but we don't want that.
Yeah, well, I've had 3 surgeons say, don't, Dr. Casey being one at U of M, and, well, I can't even remember what the other one was, that said, no, don't do any more procedures, no more surgery, nothing, because it is just getting worse.
Right.
And so my only hope is the cream. And so I don't care if my hair is greasy. It's not greasy, but when you put it in your hair.
Right.
But you can't tell I got it on my face.
No, you're
A lot of
wrinkles, see
people-
that?
Well, a lot of people use it, they say, under their makeup.
Can't they just remove the whole nerve?
No.
Nerves
No.
grow this, like the length of our
Band-Aids,
hair.
that's
So
Your wife
every,
might like that.
every,
Try the cream.
Yeah,
That's what I was
Can't
gonna
hurt.
say.
So I mean, even if they were to cut
Nothing
it
can
wherever
hurt.
it starts,
It's gonna
just take the whole
regrow.
thing out.
it's gonna regrow. It grows
you
like the length of
It
your hair
will,
every month.
it'll
Yeah.
start back from where it got cut.
I'm gonna tell you right now, if anybody calls Larry,
Yeah.
he will send you a trial thing free.
Oh.
That's how brilliant and how awesome of a
Totally
man he
believes
is.
in it.
And to
Yes.
try it.
You
And
had
it
talked to him,
doesn't
Mary Ellen?
take Within an
Yeah, I
hour,
talked to him.
and she can tell you
What kind of
this,
doctor is he?
within an hour, this had stopped burning.
No,
By
I
the next
forgot. I
day, I
didn't
could
know.
actually touch my chin, and within the 2 days, I was rubbing it in,
How long have you been using it now?
since November 27th.
And why didn't you call me about that?
And it, because it's been a bad winter and a bad spring,
That's not an excuse.
well, it's my excuse.
All the calling cards I gave you,
I know it.
used them all probably now.
It's kosher, huh?
But,
Says it on there.
so all I can do is hope that the cream by rubbing in my head just keeps
Oh, it worked
working
great.
and working and working.
Mary Ellen said she told us about a year ago, I missed that.
I think it was when
Yeah, I remember
Dr.
it.
Piper
What was
was
that?
here, actually.
I remember you telling me about it because
Yeah, I
I had
missed
the
that.
compound.
Right, it was during that time.
Yeah.
So folks at home, try that
was it?
cream.
I said I had told the group about it.
Yeah, I read about it. Try it.
Hey, Dawn's gonna do her 20-second selfie to TNA on what triggers her pain.
Okay, tell me when you're ready.
Ready?
Ready?
Go.
Okay. Hi, my name is Dawn, and my triggers, I've had trigeminal neuralgia for 25 years. My triggers are the weather is the main trigger, and then brushing my teeth, washing my hair are my main triggers.
How many,
Did I do it?
how many seconds? Oh, didn't you? I think it was.
How about eating?
Just go to camera.
Chewing.
Just go to camera.
Yeah. But you know what? Since the cream is that, I've been able to do that much better. Yeah. Yeah. I just chew on the left side.
We gotta go back to video.
But the burning down
Yeah,
my
but it
throat
should show up
is gone.
under photos.